Black mothers are afraid to birth their babies.
The Arkansas Maternal Mortality Review Committee released a new report that they say breaks down the numbers behind that statement. The report shows that in 2018, Black women birthed 19% of Arkansas's babies and made up 37% of the pregnancy-associated deaths in Arkansas.
This should be a wake-up call and a stark call to action for us to address maternal health in the state of Arkansas overall.
According to the research, Black mothers are 2.3 times more likely to die than white mothers. Several factors contribute to the data inside and outside the healthcare system.
We do not have providers everywhere we need them in the state. Some areas don't have a hospital you can give birth in. Some areas don't have OBGYNs. And then when you look inside the healthcare system, women of color don't get the same quality of care as everyone else.
In the natural state, there are no Black licensed midwives. 2 women in Central Arkansas are looking to change that. While seeking certification as midwives, Nicole Fletcher and Sarita Hendricks started Ujima Maternity Network. Their goal is to help alleviate fears of death.
You shouldn't think about, am I going to survive this, or is my baby going to survive this? But that's what we're hearing of women around the state.
She says trust and emotional support could lower the high maternal death rate.
So really, and a huge portion of that is creating space for women to see other women that look like them as practitioners, as people that can actually serve them, qualified, skilled, like birth workers that are coming along and letting, again, that space where they can let their hair down.
With that margin of comfortability, patients are able to communicate and advocate for themselves, and doctors can provide better care to help prevent 92% of deaths caused by preventable illnesses.
So, there was a report done by the Arkansas Maternal Mortality Review Committee. And while all the data and statistics that we've been talking about are quite alarming and scary, the good news is that they found in their review 92% of the deaths that occurred were potentially preventable. That means there's something that we can do about it. We can ensure that women have care. We can ensure that women get quality care and that they and their families are taken care of.
Shanae Nelson looks like a picture of health today.
They've got me running.
Rewind the clock to 2014, Shanae, 32 weeks pregnant, thought she was going in for a routine appointment. A quick check of her blood pressure and nurses put her on her side. She was suffering from severe preeclampsia.
At that point, it was stroke level. They were concerned that I was going to seize at any moment.
The only cure, deliver the baby.
3 pounds, 1 ounce. She spent 1 month in NICU.
An extremely scary time for Shanae, one that would repeat itself 4 years later.
And it was like deja vu.
But this go around, even worse. Shanae developed severe preeclampsia 6 weeks earlier than her previous pregnancy.
When Emery was delivered by emergency C-section, and it was a very traumatic experience in the way that she was delivered.
Her baby's heart rate plummeted.
She was in severe danger at that time.
But so was Shanae, her new doctor telling her bluntly there was a chance she could die.
And that's how he said it. So no compassion at all.
In a turn of events, Shanae's OBGYN came in, stopped the emergency C-section until it was safer to perform the surgery. Her daughter Emery delivered at 1 pound 3 ounces and spent 3 months in the NICU.
I'm convinced that had things gone in the way that they had initially planned, I don't think I would have woken up from the anesthesia.
Shanae's experience is all too similar to other Black women, but it doesn't always have the same outcome.
Pregnancy associated versus pregnancy related.
Dr. Gloria Richard Davis says institutionalized racism is the foundation, and it creates more problems.
Oftentimes, women try and communicate to their patients, to their providers, right? That something's not quite right. They may not know exactly how to convey that, but they know something's not right. And oftentimes they're brushed off.
This was the case for Shanae.
I shared with my doctor that I wasn't feeling well, and it was sort of dismissed as, oh, well, you're pregnant.
Other factors that have a hand in why Black women, specifically in Arkansas, have higher rates of maternal mortality, Where in the state do they live? Do they have underlying health issues? Dr. Chriselle Nash with Arkansas Blue Cross Blue Shield says Arkansas is severely underserved medically.
If something happens acutely and you need to get care, you're trying to get to an urban center, to a UAMS or other institutions, and that can have an impact on your health outcomes.
Studies show that of the Black maternal deaths in 2020, 92% of them were preventable. It begs the question, what's it going to take?
And so by doing research, you're able to give them those numbers.
As Dr. Claire Brown breaks it down, it's a tier approach.
A policy tier and the individual tier, there's a middle tier, the healthcare provider level.
The individual tier is all about women and their support system knowing the symptoms that could lead to a severe maternal event. Then, health policy. A big push now is Medicaid expansion.
By having Medicaid expansion, women who are low income are able to have insurance prior to their pregnancy or in between pregnancies so that they're able to get those conditions under control. They develop a relationship with a provider.
And finally, health provider level. This tier requires hospitals and doctors alike to do the work to create culturally aware spaces.
Having that awareness can ultimately allow for a provider to help treat their patients kind of better.
3 important points that these doctors say will help protect expecting mothers, especially ones at a higher risk. A risk Shanae knows all too well, which is why she urges Black mothers to ask questions and don't be afraid to get a second opinion.
We focus so much on the joy of bringing life into the world, but we don't talk about some of the dark side associated with pregnancy.
Having access to doctors and hospitals is crucial, especially if you're pregnant. But tonight, several parts of Arkansas do not. Thank you for joining us at 5. I'm Faith Woodard.
And I'm Rolly Hoyt. A new report from the March of Dimes says almost half of Arkansas is now considered a maternity care desert. As THV11's Brooke Buckner takes us a closer look at this problem and what different groups are doing to try and fix it.
47% of the counties in Arkansas are part of those deserts, but another 21% have low access or moderate access.
Dr. Chriselle Nash with Arkansas Blue Cross Blue Shield says the decrease in maternity care access is a problem, and there's several factors behind it. A county is considered a desert if it doesn't have a birthing center or birthing hospital, and if there aren't any OBGYNs or certified nurse midwives.
And we have hospitals that are working to take care of people, and they have to have access to resources, right, and providers. And so it has been a tough time, and the pandemic on top of that has made it even more stressful.
According to March of Dimes, 35 counties in the state are considered maternity care deserts. But Dr. Nash says maternal and infant mortality is another big issue.
Our maternal mortality and infant mortality rate is higher than the rest of the nation.
She says we also don't have as many birthing hospitals as we used to.
We have to have a concerted effort across the board to address this issue.
UAMS is one of the groups tackling this problem. Wanda Standridge is the call center director at the hospital, and she says that's one of the ways they expand their reach to women across the state.
We do high-risk maternal telehealth. We also facilitate high-risk maternal transports from rural areas or rural hospitals into UAMS.
Standridge says they received more than 100,000 calls from 2021 to 2022.
It's just trying to fill the information gap.
Rosalind Perkins with UAMS says they also focus on education, where nurses travel around the state to teach other nurses who treat high-risk patients.
Every mom with a high-risk pregnancy should have the care that they deserve, no matter where they live.
Any of my Black moms, 100% of them, their main reason for getting a doula, their number one reason is advocacy.
Alexis Jackson is a certified birth and postpartum doula.
To provide that emotional and physical support. A lot of women are looking for an extra person to help them make it through the journey.
In an expecting mother's corner, she is that extra person, a knowledgeable support system who's also willing to speak up on their behalf.
I'm here as a bridge between the mother and the medical system.
Dr. Gloria Richard Davis says across the board, Black women are more likely to have a negative outcome compared to white women.
We know that Black women are 2 to 3 times more likely to die in childbirth. And Arkansas, of course, has the same statistics.
For Jackson, that statistic almost became her reality.
I wish I would have had someone there. My pregnancy was fine. It was normal. Everything was going great up until it didn't. One day I woke up and I was like swollen from the waist down. Couldn't see my ankles anymore. It was bad.
Advice from family downplayed this as simply normal pregnancy symptoms. They weren't. That same day, Alexis was rushed to the ER.
I had preeclampsia.
A whirlwind, as she describes it, led to an emergency C-section.
2 o'clock in the morning, the lights come on, nurses rush in, we have to take the baby now. And my son was 6 weeks early.
The problems caused by preeclampsia often go away after a baby is born, but for Alexis, this nightmare continued, getting much worse.
Unfortunately, I was not looked after the way I was supposed to have been. My mom found me on the floor. I ended up having a seizure while she was gone. The nurses didn't know I was there on the floor. I ended up having 3 more seizures before they decided to give me meds.
Unconscious for a week, Alexis woke up in a new hospital, needing 2 more weeks of observation before returning home.
Only to turn around and come back within 24 hours because I ended up with a pulmonary embolism.
Blood clots and half her chest filled with fluids, leading to another 2-week stay in the hospital. She looks back now with a stark realization.
Myself included, almost became part of that statistic.
But Dr. Claire Brown with UAMS says that most Black mothers don't have to fall victim to these issues.
Around 90% of maternal mortality is theoretically preventable.
Data from the Arkansas Maternal Mortality Review Committee backs that up. A recent study shows out of Black maternal deaths from 2018 through 2019, 91% of them were preventable. But that same study also reveals how big of a problem this is in Arkansas.
We have a rate of about 40 per 100,000 live births. The rate nationally is closer to 32, so that's around 20% higher rate of maternal mortality. Unfortunately, we're ranked very worse in terms of maternal mortality overall.
These numbers can be hard to reckon with, but some healthcare professionals in Arkansas are working to mend the era of these large disparities for Black women.
As a provider, right, I'm concerned that our healthcare system is failing patients.
It's incredibly important to consider institutionalized racism. It theoretically exists from the provider up through the policy level.
It may take a lifetime of work.
We're working to do that. We are absolutely working to do that.
But respectful, equitable care is the end goal.
A patient, regardless of her race, religion, ethnicity, when she enters our healthcare system, she receives equitable care. She is listened to.
And today, as Jackson bridges the gap as a doula, her traumatic delivery,
I do hold on to my personal experience,
is a guiding light for the pregnant women she now helps.
I'm going to be that person for you because everybody's going home. At the end of the day, everybody is going home.
In Little Rock, Michaelan Johnson, THV11 News.
Oh, wow. You know, the first step in making change is to shed light on the problem and hearing the stories, and we just did that.
A very important conversation, and local women, you know, going through these some of these issues. So we'll, of course, follow up on this
91% preventable.
Yeah.
Well, there are some policy changes that are hot topics in the state right now, including advocates pushing for a Medicaid extension.
This change would allow Medicaid coverage for women a full year postpartum. Right now, it's only 60 days.